Autoimmune disorders, to me this is probably one of the biggest things in our society that's directly diet related. And I say that because everything we eat is processed, everything we eat has gluten added to it after the fact, after the gluten that's already naturally occurring in it, as an example. For example, in a month from now we're all going to sit down and have Thanksgiving dinner. Most of you are probably going to eat a turkey with gluten in it, and probably didn't know that. Okay? They inject meat to make it look bigger and plumper and whiter. Whether it's seafood, scallops is another big example. They make them look nice white and shiny white. Why? Because they inject gluten and water into it to make it look bigger, make it look like you're getting more for your money. Gluten is added to everything. So, as an example, of course, if we go over to Europe and look at Italy, their diet forever has been very grain and carbohydrate heavy, right? Pasta, breads, pastries. So many people now in Italy are gluten intolerant or have celiac disease that the Italian government has mandated that every restaurant has to have a full gluten-free menu. And I think it will just be inevitable that this country has to get to that same point. And I don't think it will be the government mandating it, it will be people demanding it on their own because they just won't be able to go out to eat anymore. Because as years go by, people are getting progressively sicker from this constant exposure to glutens and other pro-inflammatory carbohydrate compounds. The issue is, and one of the things up here that we see quite often, hypothyroidism from an autoimmune response called Hashimoto's disease, is overexposure to gluten. What happens is if you look at a gluten molecule under a microscope, to your immune system it looks very, very similar to thyroid hormone or thyroid peroxidase enzyme. And because of that, as your immune system starts to attack gluten and becomes sensitive to gluten, it starts attacking everything that looks like gluten. And to your immune system, your thyroid looks like gluten. So it starts destroying your thyroid gland. So you start experiencing symptoms of hypothyroidism, yet they check your thyroid labs and they're fine. But people are sitting here saying, well, why do I feel awful if my thyroid is normal? And then we run into this cascade. The trick in that instance is not actually doing anything to the thyroid gland. It's not a thyroid problem. It's an immune system problem. It's an autoimmune reaction. You have to find the source of that autoimmune reaction and treat that appropriately, eliminate that from your diet or whatever it's being from. Could be low vitamin D is another very common trigger of autoimmune disease. And correct that functional problem for that individual. So, whether it's thyroid gland, in the brain, MS is very common, especially in northern climates. Lupus is another big one. Obviously, abnormal, I mentioned insulin resistance. Very specific versions of arthritis. In fact, and this actually kind of crosses a little bit into Lyme disease. A lot of people come in actually with all of the signs and symptoms of rheumatoid arthritis, but they don't have rheumatoid arthritis. They test negative. And it's not that they have rheumatoid arthritis, they have Lyme disease. And again, there's such a chronic immune reaction going on to try to fight off that Lyme disease, they're actually developing immune reactions in their joints. And of course, chronic inflammation in a joint destroys the joint. And that's where you get it. You get swelling of the joint, you get erosion of the bony end plates, etc. Of course, fibromyalgia, which we're going to talk about in here as well. And then all skin eruptions. In fact, clinically, anytime anybody has various skin eruptions that are unexplainable or will crop up and then go away and pop up in another area are classic digestive symptoms. Almost always that person has a sensitivity to something that is yet to be determined. Now, as an example, when we test somebody, let's go back to the gluten version. Let's say we test somebody for gluten and they have a high sensitivity to it or a true allergy to it, and there's a difference. A true allergy is something most people are aware of already. For example, either when you eat that particular antigen, your throat closes shut or your eyes swell shut or something happens that hey, I can't eat that. Peanuts, milk, most people know that they're allergic to those types of things. But in a gluten intolerance situation or sensitivity situation, you might not have any overt symptoms of gluten sensitivity. Maybe when you eat gluten, maybe you just get a little bit more belchy than usual. Or maybe you feel a little bit more sluggish after you eat than usual. Or maybe you start to get some dry patches of skin in different areas. Those all could be from gluten sensitivity, and that person is just not recognizing it. The problem is that person is going to keep eating gluten over and over and over and over because they're not associating what they're eating with causing these problems. So it creates a cumulative effect. Obviously the body heals its patches, but as you ingest more of that gluten, now they start to crop up in other areas even if the old ones go away. As an example, one of the things that's very important with this is when we identify a gluten sensitivity in somebody, or any food sensitivity, if they have a very elevated sensitivity to that particular food or ingredient, it can take, if that person were to accidentally eat it one time, it can take your immune system up to 6 months to calm down from that one exposure. So you have to be very good about watching what you're eating if you're having symptoms of autoimmune disorders, because very commonly it's due to something you're eating, period. Okay? In fact, there are a lot of practitioners who have moved to a point where anybody who comes in with any type of an autoimmune, already diagnosed with some type of an autoimmune disorder, or clinically, if the clinical picture looks like an autoimmune disorder, they won't even bother testing anymore. They will automatically take them off all gluten and all cow's milk. And automatically say, look, just avoid this and you'll probably feel better. And guess what? Most of the time they're right anyway. Because those are two things that we frankly shouldn't be eating as human beings. Treatment should include the antigen, which we just mentioned. You need to obviously avoid whatever is ramping up your immune response. You can also take different things to help desensitize your immune system. As an example, there are supplements or nutrients that will help downregulate your immune response. A couple of things that we use very commonly, one of them is called Moducare. They're basically plant sterols. And what they do is they help your immune system calm down faster.
What is it called again?
Moducare. It's M-O-D-U-C-A-R-E. Yeah. That's one of the biggies that we use. Anything also that is going to be anti-inflammatory, so your omega-3 fatty acids, turmeric, or in supplement form, a lot of people take curcumin, which is the active ingredient of turmeric, if you don't want to use turmeric cooking. Other things that will be very anti-inflammatory. There's a very good herb called Boswellia that a lot of people use and works very well. And you can combine that with a couple other herbs. White willow bark is an example, which is kind of actually the natural version of aspirin, where aspirin was derived from.
One little question, because you're on a roll. This is very informative. Can a person take omega-3s without taking fish?
Can you take it without taking fish?
Like, can you?
Yeah, you take like an evening primrose oil. There are plant versions of omega-3s that you can get without
Sensitive fish.
Correct. Yep, absolutely, absolutely. And there are all kinds. In fact, if somebody is allergic to shellfish, we would test in the office to find out what versions they could best have. And not only just which ones to avoid, but based on their profile to say, okay, what ones are going to be best assimilated by this person. So. There are also different prescriptions that downregulate the immune system. Obviously, we're an integrated medicine clinic. We don't use prescriptions hardly at all, but we do from time to time. One of the main prescriptions that we use for this situation is something called naltrexone. And if you guys go online, you can Google low-dose naltrexone therapy. And it's one of the primary prescription means, or integrative means, let's say, of treating autoimmune disorders. The primary two being fibromyalgia and MS that's been targeted for. Again, treatments that desensitize the immune system to antigens, there are a host of them, but like I said, adding the anti-inflammatories in there, avoiding the foods, avoiding the antigens to which you're sensitive. And then also, we have to heal the gut lining. Part of the reason that these happen in the first place is if I were to, I should have had an image of it because I like images, but if I were to cut your large intestine or look down your large intestine, the walls would basically look like a colander, okay? They're very porous. They're intended to be porous so that as your food gets broken down, the nutrients can be pulled out of the food and into your bloodstream to be utilized, okay? The problem is those holes are only supposed to be big enough to let the nutrients through and nothing else. Over the course of time, let's say you eat something that is very difficult for your body to process, like gluten as an example. I always pick on gluten because it's the most common one anyway. Gluten is a very large molecule. Your body has a very difficult time breaking it down and using it and absorbing it. What that does is that creates inflammation in the gut lining, and it slows down your what we call transit time, meaning the time it takes from you to eat to the time it comes out the other end. That's your transit time. Normal transit time is 24 to 48 hours. Some people argue it's actually even 6 to 12 hours depending on what you're eating. But at the very worst, 24 to 48 hours. As your transit time slows down, now you literally have fecal matter building up along the walls of your large intestine, and that creates an inflammatory process. What that inflammation does over time is it makes those holes bigger. And now, instead of letting just nutrients through, we let bigger pieces of undigested food into the bloodstream, to which now your immune system, which is literally 70% of all the immune cells in your body, are wrapped around your large intestine. They're called Peyer's patches. Those activate and have to kill anything that they recognize as foreign. That's the only gateway from the outside world to the inside of your body, is through your large intestine. So whether or not you get sick is largely due to the integrity of your large intestine, your large intestinal lining. So as those holes get bigger, it's now letting bigger antigens through, and now your immune system makes an antibody to that particular food. And so now you're corn sensitive, or you're gluten sensitive, or you're pork sensitive, whatever it might be. And so a lot of times when we order what's called a food sensitivity test on people, and it checks, I think it's 90 some odd different foods that people eat or ingredients. And it will determine for us what foods are they sensitive to, and more importantly, how severely sensitive. From that, if out of those 90 foods, let's say a person comes back and maybe there's only 2 or 3 foods that they're sensitive to, the treatment then becomes very straightforward. It's literally avoid those 2 or 3 foods. But in a lot of cases, they're not sensitive to 2 or 3 foods. They might be sensitive to 20 or 30 foods. So if we were to take them off all of those foods, they'd be looking at us like, well, what in the world can I eat? And so what we end up doing is we don't treat them as false positive responses. We treat it as your body is allergic or is sensitive to so many things because your large intestine is not working. So the treatment doesn't become to desensitize to the foods. The treatment becomes restoring health to the large intestine. And there are very specific ways of doing that. First of all, you have to establish normal good bacteria ratios in the large intestine. It's the good bacteria that help you break down your food and pull out the nutrients for you. They also make some of our nutrients that we need, like vitamin K as a primary example, are made by your good bacteria. So as a side note, a lot of women, especially younger premenopausal women, who are having low bone density issues, a lot of times it's because their gut profile is terrible, so they can't make vitamin K, which is essential for bone development or bone maintenance. Other things that will help heal gut lining are, there's an amino acid called L-glutamine, which is very good at shoring up the size of the holes in the large intestine and restoring the fibers of the large intestine, are called villi, that are responsible for absorbing a lot of those nutrients through into the bloodstream.